Hi there, this is Anna Dolopo. I'm a board certified and licensed acupuncturist, and I've been in practice since 1999. This video is specifically to acupuncturists all around the world. Whether you practice in the States or anywhere abroad, this video is for you. I teach with the Academy of Acupuncture, and the subject matter that I teach is the business acumen of successful acupuncturists. I recently taught a class, and it is always about increasing our revenue, but this class that I'll be teaching on May 1st is not just about increasing business, but it's especially about creating clear expectations regarding specific health issues. I go in and out of different forums, both on Telegram, on WhatsApp, and on social media, Facebook, Instagram, and some other online platforms. And I see some of the same questions being asked. How do I treat this? And I'm stumped, what do I do? And I can tell by the questions being asked, the level of your competency, not all of you, but many that I've seen, the level of effectiveness you provide in your practice just based on your questions. So I'm going to, if you go to successfulacupuncturist.com, you'll see that I've addressed quite a few of these on some videos, but they're private videos, so you'd have to become a member in order to watch those videos. But I'm giving the opportunity to understand how I think as a practitioner of 23 years and create results in my practice. If you want to check out my work, you can go to elementsinharmonyacupuncture.com. I'll put all these links down in the description. So, for example, when I say creating clear expectations, do you know how to confidently tell your patients, your clients, what they need to do in order to achieve results? So say, for example, today I saw patients with psoriatic arthritis, fertility, sperm issues, motility, morphology, mobility. So not just women's health issues when it comes to fertility, but also men with erectile dysfunction, men with sperm quality issues, women who've had 3 to 7 miscarriages, high-risk pregnancy care, low-lying placenta previa, marginal complete placenta previa. I just treated someone effectively, 6 treatments, complete placenta previa. And I see on different forums that women, practitioners don't know what to do with women who have complete or low-lying placenta issues. Other types of high-risk pregnancies, liver issues, blood pressure issues, sugar, gestational diabetes issues, severe depression, severe anxiety. Patient came in today. She has 5 children, and she also works, and she had severe anxiety. And today, she reported that she is at least 50 to 80% improvement, and that's after 10 treatments. And she's so happy because it was almost debilitating. If you know anyone with mental health issues, depression, anxiety, feeling overwhelmed, feeling sad, feeling alone, feeling really, like not supported, how do you treat that? How do you share with people what to expect? Or do they come in and you don't give them clear expectations, and they think, because many of them do, think that you're going to heal them or give them 80+% improvement in one treatment? Chronic neck issues. Do you know what to do if someone's had pain for 5 or more years and they have bulging disc issues, herniated disc issues, they've had 3 or more surgeries, and the surgeons are like, we're not touching you anymore? Do you know how to prepare people for surgery? Do you know how to effectively and clearly share with your patients, with your clients, what they need to do in order to prepare for surgery? What if they don't want surgery? What if your patients come in and they say, you know what, 5 surgeons have told me they want to do surgery, but I'm adamantly against it? How do you go forward in that conversation? What are your options that you can give them that they can believe in and that you can believe in? Severe adrenal fatigue. I have a patient who is visiting from Texas, and she gave me a laundry list of what she wanted me to treat, and it's been about 5 treatments. And she's amazingly doing much better. She's so much better. She has so much more energy. She's sleeping better. She's happy. And she's not a first-time patient. She's come in over the past few years. But unfortunately, there was a She lost her baby. So, you know, that kind of puts someone, when you're dealing with someone with grief, you know, are you really going to graduate them from depression in 5 treatments? How do you convey to these patients that maybe it might take more than 1, 5, 10 plus treatments? How do you explain how they need to take herbs, why they need to take herbs? Maybe they need to do other types of modalities like massage, cupping, moxibustion. And when do you know to refer out? When do you know to integrate your medicine with physical therapists, chiropractors, Western medical doctors, therapists, talk therapists, naturopathic doctors, and other types of healers, other types of practitioners? Do you know how to, like if someone's also seeing a physical therapist, I tell them, if you're starting new with a physical therapist and me, choose one. I'll give you a little nugget. Don't do both new medicines on your body for the first 10 treatments. Choose one. Choose a physical therapist or me. And if that physical therapist or I get you to at least 80% improvement, minimum 50% improvement by treatment 10, you don't need the other practitioner. Just keep going. And there's a lot more information, but that's just a little beginning of the conversation I have with patients. And because I say it with conviction, they automatically believe me. Of course, giving the information that I've been in practice since 1999. They see my website, elementsinharmonyacupuncture.com. They see that I am competent. But what do you do when it's your first 1 to 5 years, or even before 10 years, and you don't have a website yet? You don't have any online presence. And I share this you don't need hundreds or thousands and thousands of followers. Mary Kay Cosmetics said, one committed customer is far more important than 1,000 interested customers. So if you see someone with 10,000 likes, how many of those 10,000 likes are actually coming to see you? And I taught this in my little seminar a month ago or so. If there's like 20 likes on my video and all 20 come to see me, that is 100% success rate, and their lifetime value to me as a patient is anywhere between 20 to, anywhere between minimum of 5, if not 20 to 50 treatments. Don't you think that was worth doing that free video? This is how my videos are. There's, I'm about to hire a professional videographer, so it's a lot more professional, and they'll do their thing. But on the 156 videos I've done, I've gotten so much business, and they're all free. So I know I went on a tangent there, but there's a lot of information that you can put out on social media for free just to get one patient in, even if it's for one treatment. So, but you gotta convince people that you're worth the investment. One, people want to know, I'm suffering from this. A physical issue, neck pain. Psychological issue, they can't sleep. They are anxious, they're up all night. Internal health issue, they have compacted, they are severely constipated, where their doctors have to tell them, take this medication. If this medication doesn't happen, then we got to open you up to get the stool out. That's how severe some digestive issues are. Or stage 4 cancer patients. Do you know what to do if you have a stage 4 cancer patient and their doctors have to temporarily cease their chemotherapy, temporarily cease their oncology treatments because their kidneys are pretty much failing at that point? And my job, your job, is to increase the value, the functionality of the kidneys so that they can sustain, they can endure more chemo, more, whether or not you agree with oncology treatments, that's not the point. The point is the patients are coming here with multiple sclerosis, trigeminal neuralgia, cancer, severe internal issues, autoimmune issues. My job is to not dictate to them exactly what type of medicine to treat them. My job is to give them the support that they need. Now, if they want to only do acupuncture for whatever they're coming in, then they have to have clear expectations. And I've done accountability videos. I've done expectation videos. And they understand what to expect. I can give you the answers, but if you can't convey with conviction that you have what it takes to heal them, they're not going to be your patients until they heal. So they want to know, I'm suffering. Can you help me with this? How many treatments is this going to take? How much do you charge? I see questions on these social media platforms, and I'm astonished that a lot of you don't know what to charge. You don't know how many treatments for them to come in. You don't know how many times a week for them to come in. You don't know for how many times, for how long, and you don't know how long to keep them in your office. Should I keep them there for 20 minutes, 30 minutes, 45 minutes? A lot of people are surprised. What do you do when you keep them for 1 to 3 hours? Some patients are here, 30 to 45 minutes. Very few. Most patients stay 1 to 3 hours. And I explain that in my videos. How do you explain to people how you're going to treat their adrenal fatigue, their back pain? They've had multiple surgeries and they don't want any more surgeries. Or their surgeons are like, we can't do any more surgery on you. Or they don't want to do surgery. And 5 surgeons are saying, if you don't do the surgery, you're going to be in a wheelchair forever. Or you're going to end up in a wheelchair. How do you address that? What do you do if your work is not happening after 3 treatments, 5 treatments? Do you know an exit plan? Do you know who to refer them to? Do you know what are the next steps? Do you know how many treatments it's going to take? You hear me say this over and over and over in my videos. The beginning phase is the first 10 treatments for easy cases. The beginning phase for chronic issues is the first 20 treatments. So how do you deliver that while a patient is thinking, I can't afford this? I don't know if I can afford this. I'd rather suffer. So how do you address that? They're there for a reason. The goal in your social media marketing, if you don't already have one, then you should start, is they should already know that there's going to be some expectations clear expectations by the time they come in, so that when they come in, they're ready to sign up. I'm ready to do this. I want to heal. I've been suffering for 10 years and I can't handle it anymore. And my doctors have given up on me. And quite honestly, most patients who were referred by their neurologists, by their psychiatrists, by their surgeons, by their cardiologists, most of them are their throwaway patients. And it sucks to hear that, but I know that. Or they just, many of them are very integrative medicine and they want to see how my medicine is going to help their patients, so we can work in conjunction, we can work integratively together. So I mentioned stage 4 cancer, stage 4 kidney disease, severe menstrual issues. What do you do when a patient comes in and they were in the ER for 3 days? What do you do with a patient who was in the ICU for 8 days and, they were discharged and now they're trying to improve their quality of life? So, we're not surgeons, so we're not at the top of the totem pole when it comes to medicine, but I behave like I am because I know I'm going to provide something that's going to improve their quality of life. And I have many physicians and nurses here that believe that and understand that, and they incorporate the medicine that I practice in their lives. And one more thing before I let you go is that there are people who come to see me and I ask them, you're with this other practitioner, this other doctor, why are you coming to see me? If it failed you, it says here the acupuncture didn't work. They will say, because you look more competent, or I heard this from someone else. So for those of you, especially maybe in the first 10 years of practice, but maybe in your first 1 to 5 years, I might know something that can help you. And I'll tell you this, there's this data, this paper that I give to my patients. It took me 15 years to get that paper together. It took me 15 years of practice. So I've been in practice for 23 years. The last 8 years, I really know what I'm doing, really. It took me 15 years to really understand how to deliver information. So if you think it took me 3 years, no, it didn't. It took me a long time. I met my master in 2006, March 6th, the late Grandmaster Dr. Richard Tefutan. So it is called a practice for a reason. So if you want to learn from me, I might teach you some stuff. You can go to the Academy of Acupuncture, register there for May 1. For those of you here in the States, it'll give you 4 CEUs, 4 PDAs. And I tell people, $200 will change your life forever. All right, so if you want to telegram me, 619-341-4341. You can go to elementsandharmonyacupuncture.com or successfulacupuncturist.com. Take care.